If you would have asked me if I would have been digging a car out of the snow and mud 3 weeks after knee replacement surgery, I probably would have laughed, knowing what I had been set up to believe the future held for me. Hi, my name is Jim. I'm 53 years old. I live in Stamford, Connecticut. Although I'm originally a New Yorker, I like to bring that to everyone's attention. I have been nursing this knee since a baseball injury for about 30 years. I have done everything that you could imagine. I've had more shots of gels, cortisones. I have had my blood spun in a centrifuge. I found that all these things worked great until I engaged myself in activity again. And it dawned on me that as soon as I got active again, I was right back to where I started. You know, I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game. I did settle into a group in Greenwich, Connecticut called ONS. I started with a Dr. Paul Sethi, who was awesome. And he suggested that I talk to Dr. Delos. Not jump into anything, but talk to this great, younger, aggressive surgeon that they had brought in from Hospital for Special Surgery, who was up to date on all the new, latest, greatest techniques. I had the X10 dropped off at my house a few days before my surgery. So I played around in it. I did a couple sessions in it. I understood it. I have to tell you, it became a focal point of my recovery. I look forward to getting up, getting in that thing in the morning, tracking my progress. I'd make a cup of coffee. I'd put on the news. I'd close the door to my office. I'd sit down in this. And for 30 minutes, and sometimes more, because I would add time to the machine to keep going if I felt like I was making progress and wasn't overdoing it, I was in like this great happy place. It was like being on a little bit of a vacation. Now, it's not all vacation. As you're increasing your flexion and your extension, it hurts a little. It really was a great, great addition to my rehab and really something I looked forward to doing. I think when I left the hospital, I was at about 30 degrees of extension and about 80 degrees of flexion. After 2 weeks on the X10, I believe I maxed out, and I do have this charted because I was real careful with it. I got to just shy of 130 degrees of flexion and to 0 degrees extension. I really believe that the work that I did got me to a position faster in my recovery. I'm able to get up and drive the car. I'm able to go to work. I have great range of motion. I go up and down the stairs. All these things that were potentially an issue to me. I know that the fact that I was able to create greater range of motion faster got me back to a more normal everyday life much more rapidly than I would have without it. If you're lucky enough to be in a position where you can get on one of these machines or get to the good doctor and get to good PT people, put in your work, because now it's on you. You have all the vehicles to make it happen.
X10, back to full strength.